Welcome to Let's Talk Aged Care. My name is Helen Morley, Country Programmes Officer for Council on the Ageing, more commonly known as COTA SA. Let's Talk Aged Care is a series of information sessions to help you to understand, register and connect with My Aged Care. We will also include a session on advanced care directives. These sessions can be watched individually or they can be watched all together, depending on your needs. The session is brought to you by COTA SA and funded by Country SA PHN. Firstly, let me tell you a little bit about COTA SA. We are an older persons movement run by, for and with older people, and you can join as a member should you wish. COTA SA represents the rights, needs and interests of the 633,000 people over 50 years who live in South Australia. Our priorities are your priorities, and we know from you that the cost of living, employment, housing, health, ageing and discrimination are key concerns for older people across the state. In addition to our policy and advocacy work, we offer many exciting opportunities and programmes for you to be involved in, such as the Plug-in, Strength for Life, our Rainbow Hub activities, or volunteering with us, to just mention a few. We would love to hear from you, so please do call COTA SA on free phone 1 800 182 324, or if you prefer email, acs@cotasa.org.au.
Welcome to Let's Talk Aged Care, the introduction to My Aged Care. My name is Sue Bell and I will take you through the registration and assessment process. My Aged Care is the national entry point to access Australian government subsidised aged care support. If you are 65 or older, or 50 if you are an Aboriginal or Torres Strait Islanders, there is information on the website, or you can phone My Aged Care. If you need an interpreter or speak a different language, that is also available. If you are vision impaired or hard of hearing, there is information on the website by calling My Aged Care. Whatever your community is, My Aged Care is there to support you. The contact centre is available Monday to Friday, 8 a.m. to 8 p.m, and Saturdays from 10 a.m. to 2 p.m. If you prefer to look online, the website is www.myagedcare.gov.au. My Aged Care is the front door for registration, information, any subsequent programs. This may be short or longer term support. This is determined with you as you register to My Aged Care and then have an assessment in your home. Your My Aged Care journey depends on your specific needs and wishes. You may need just a little support through entry-level care or more support through more complex care. The focus throughout is to provide enough support to keep you living independently. If you do require longer term residential care, this is also accessed via the system. Before you register to My Aged Care, you will need to have a few details at hand: your Medicare card, pension concessions or Department of Veterans Affairs if applicable, and have your doctor's details ready. Before you register with My Aged Care, think about what is important to you. Are you struggling with living independently? Now you cannot drive your car. Do you need assistance with cooking, cleaning, or grocery shopping? Would transport assist you to keep you socially connected? And remember, this is all about what is right for you. Depending on your preference, you can register with My Aged Care on the phone or on the website. Whichever you choose, the process will take 20 to 30 minutes. It is advisable to have somebody with you who can act as your representative, preferably a member of your family. If you have been in hospital or seen your doctor, registration is sometimes done this way. You should be informed. If you register online, you can register yourself or a close friend or family member. Once registration is complete, you will be given your own aged care identification number. Keep this safe and use it anytime you contact My Aged Care. At the end of the registration process, it may indicate an assessment in your own home is required. This is an important part of the process, and it allows the My Aged Care assessor to see you in your own home environment, and it gives you a chance to meet someone from My Aged Care face to face. The My Aged Care assessor will phone you or a representative to make an appointment to visit you in your own home. Have someone with you when they visit. An extra person listening is helpful. The assessment may take 60 to 90 minutes. The assessor works out with you what is helpful for you, and they write down a plan for you to keep. They will leave you with information about aged care services and what the next steps are. Following their visit, you will receive letters from My Aged Care. This may cover a summary of the visit, and depending on what care you need, it may indicate what level of support is approved for you. Welcome to Let's Talk Aged Care, the entry-level care session. My name is Sue Bell. Following registration and a home assessment by My Aged Care, it may be identified you require minimal assistance. This is provided through entry-level care under the Commonwealth Home Support Program. This can be short-term support or possibly longer, but will only give you a maximum of 2 hours a week assistance. Some examples are help with housework, transport, meals, or keeping you socially connected with your community. It is expected that you will contribute towards the cost of services you need. The Australian Government subsidises the organisation that give you the care so they can keep the costs to you as low as possible. Entry-level care focuses on keeping you living independently at home and identifies what you can do, not what you cannot do. The support assists you to manage daily tasks after a setback, short or long term, by providing equipment to make cooking or cleaning easier. The organisations may use words like wellness, re-ablement and restoration. These just mean they want to keep you well, happy and independent, with a little bit of extra practical help or adaptation in your home as you require. If at any time you or a loved one's care needs increase, a reassessment of the level of support provided through My Aged Care can and should be reviewed. People's needs can and do change. Welcome to Let's Talk Aged Care, the more complex care session. My name is Sue Bell. Following registration and home assessment by My Aged Care, it may be identified you require more frequent or complex and ongoing care services than is available through the My Aged Care entry-level program. This high level of care and coordination is provided through a home care package. Packages have a tiered system with levels ranging from 1 to 4. Level 1 is a basic package and Level 4 provides quite high care. You will be approved for the level of package that suits your requirements. You receive this approval in writing following the assessment in your home. Each level of home care package has an annual amount of money attached to it. This contributes to paying for the care you need. The approval of a package does not mean your care will start straight away. You are placed in a national queue, and when this package is assigned to you, you will receive a letter from My Aged Care letting you know what to do next. There is a period while you wait for a package to be assigned to you. The government is working on radically reducing this time wait, so you may be offered access to some lower level services until your actual package is assigned to you. Once your package is assigned, you have a few weeks to find and secure organisations to deliver the care. This time can be extended by contacting My Aged Care if you have not decided. Finding organisations that provide services in your area can be done by phoning My Aged Care, or if you prefer, looking at the My Aged Care website. Usually the assessor who came to your home leaves brochures also. Depending where you live, there may well be several organisations to choose from. You can have more than one organisation deliver your package of care. Choose something that suits your needs. Shop around, chat to friends or family. My Aged Care recommend you consider what services are available at that organisation, the quality of their care, for example, how you are treated as an individual, and lastly, always consider the costs. They do vary. Ask questions about these points. Remember, what suits one person may not suit another. It is your choice and you have a right to receive quality care. Once you select an organisation, they provide you with a home care agreement setting out all the details of care, costs, and how they will manage your package. It is important you understand your home care agreement, and it is recommended you seek advice from a professional or family advocate. You can change your care organisation at any time, and they must allow you to move and facilitate the process once you select an alternative care organisation. You are expected to contribute to the cost of your care if you can afford it. Hardship programs are available should you be eligible. Your personal contribution depends on your income. If you receive only the pension, you may pay a basic daily fee. If you receive additional income, you may also be asked to pay an income-tested fee. This is in addition to the daily basic fee. Both these fees are charged 7 days of the week. The package will pay the rest for you. It is advisable to negotiate these fees with your organisation you choose to deliver your package of care. Organisations will also charge package management and case management fees. Ask about self-managing your package. This can be an option. If you choose to change organisation, some charge an exit fee. All fees and charges should be very clear to you in writing before you sign your home care agreement. Services Australia offer a free financial information service. They can be contacted on the phone, and in some cases you can request to meet your nearest service officer. It is your right to receive high quality care, services and interaction along your aged care journey. If you are not happy with any aspect, You should seek assistance to rectify this. There are various organisations to advocate for you if you choose. Contact Older Persons Advocacy Network, known as OPAN, on 1800 700 600, or the Aged Care Quality and Safety Commission on 1800 951 822. These are both free phone numbers and both are available online if you prefer. Welcome to the Advanced Care Directive video session. My name is Sue Bell. In this video, I will give you the information and resources available to you and your loved ones. The Advanced Care Directive, or ACD, came into effect on the 1st of July 2014. If you have a medical power of attorney or an anticipatory directive, these are still valid unless you complete an ACD. An ACD outlines your preferences for your future care, your beliefs and your goals. An ACD is not a will and cannot be used for financial or legal decisions. In a crisis, your loved ones may find it difficult to make a decision on what treatment is best for you, as it is impossible to know what will happen in the future with your health. An ACD will help everyone know your wishes if you cannot tell them. Having an ACD allows you to formally appoint a substitute decision maker if you can no longer make decisions for yourself. How to make an ACD? Use the Government of South Australia ACD Do-It-Yourself Kit. These are available to buy from Services SA Centres or complete or print online. www.advancedcaredirective.sa.gov.au. You do not need a lawyer to complete an ACD. The sections in an ACD form include your personal details, appointing a substitute decision maker, which is optional, what is important to you, what types of health care you do not want, if applicable, an interpreter statement, and having your Advanced Care Directive witnessed. There is an ACD wallet card included. Always keep this with you. Who is a substitute decision maker? If you choose to have one, it must be someone 18 years or older whom you trust. You should ask yourself, am I confident this person will make decisions based on what I would want? They should be comfortable making decisions in difficult situations. Health professionals and family members must follow a valid ACD. They cannot override it. Your completed form must be signed firstly by your substitute decision maker if appointed. Take it then to an independent authorised witness. A suggestion of a witness is a local justice of the peace. With this witness, you then sign the ACD. The witness will now also sign. Provide a certified copy to your family, your substitute decision maker, your doctor. If you have a My Health record, you can add your ACD to it. Changed your mind, you can cancel and not replace your ACD at any time, or cancel and replace it, especially if your own preferences alter or substitute decision makers need to change. If you do replace it, make sure everyone you gave a copy to gets the new version. What should you do now? Act now and complete an ACD. It is an important document to have. Contact COTA SA and ask about ACDs. Call 08 823 2 0422 and email acs@cotasa.org.au. This session is brought to you by COTA SA and funded by Country SA PHN.